outbreak could spread in the U.S. after the CDC confirms that one case now reported here in the United States. It's in Washington state. There are hundreds of cases reported in Asia. Right now, at least 6 people have died so far.
Here to break down what exactly this virus is and what precautions are being taken is Dr. Ramis Kassiri with FSU's College of Medicine. Thank you for joining us today. First of all, can you just tell us what the coronavirus is, what are the symptoms, and how is it spread?
So the coronavirus is a virus that we've encountered before. Years ago when we heard about SARS and MERS, those that were got people very sick in the 2002s and then again in the 2013. It's a virus that we typically see in animals, but unfortunately there's concern right now it's starting to spread from human to human contact. The symptoms are just very basic in terms of fever, headache, cough, runny nose. Nothing out of the ordinary in terms of what viral illness looks like.
So I'd have to imagine, you hear this, and we were talking in the newsroom before we came on air today about Ebola most recently, and the scare that it could potentially come to the United States. We talked about a case of this has been confirmed here. Should there be a worry among people in the States that this is something that we could see here in the United States? Absolutely.
I mean, the case that you are mentioning, this was someone that was in that region of China recently in January, and the CDC had 3 different airports that they amped up the screening in. He came through another airport. So that tells us that it's not what we think it's going to come from. It could be anywhere. And now that we have one case and we don't know how transmission is working, it's very possible that more people are infected, especially that we're currently in the flu season. So the symptoms are very vague.
Okay, so given the chance that we come into contact with someone who's traveled to that region of China or maybe who shows symptoms of having the coronavirus, what are some steps that we should take to deal with that person?
Wash your hands.
Okay.
Wash your hands. The CDC has a little bit of criteria for healthcare provider, how we screen for someone that potentially has the illness. And it involves if this patient has fever, if they have upper respiratory symptoms, and they've been in contact or recently in that region. So if anyone is suspected of having that, immediately place a mask, and if it is you, then try to stay home. And the next step is that the CDC has a couple of phone numbers that they ask you to reach out to them because they're the only ones that do the testing for it right now.
Oh, wow.
Chances are somebody is going to come in contact with this. It could be an airport, something like that, as they are traveling. Is there anything that you would further recommend to people that are planning to travel as far as precautions that they can take?
Washing hands. So I'm an internist and a pediatrician, and the way that I got through my training not getting sick as much as I did is washing my hands. So every single time you come in contact with a surface or touching another person's handshake, anything like that, especially when you're in a place like an airport where you can't guarantee where someone has been, just make sure good hand hygiene, washing your hands as much as possible, and avoid touching your face.
Is a sanitizer the same thing?
It's not as good as actually washing your hands. The sanitizer, we obviously use it in clinics and hospital, and it works well, but washing your hands for 20 seconds is the best approach, especially with this particular virus, because we're still learning more about it.
Wow, cannot underestimate the power of a good hand wash, right?
Yes, absolutely.
Okay, doctor, we appreciate you coming in today.
No problem.
Thank you.
My pleasure.
We'll be right back.